Hi there, my name is Peyton and I will be instructing you on gestational diabetes today. So first to start off, what is gestational diabetes? It's a form of diabetes that develops after a woman becomes pregnant and she didn't have any form, whether it was type 1 or type 2 diabetes prior to becoming pregnant. According to the CDC, gestational diabetes was diagnosed in about 2 to 10% of births in the US last year. So it isn't necessarily extremely common, yet not entirely rare. So it's something to very much be aware of. So, how do you develop gestational diabetes? So, a lot of researchers aren't entirely sure of the full patho behind gestational diabetes, but it's known to be developed due to the significant changes in hormone fluctuation and levels throughout the time of pregnancy. So, when this happens, a woman's body, what we do know, is struggling to produce enough insulin to supply both her and her fetus. And this most likely is attributed to building up some sort of insulin resistance due to the increasing demands that both her and the baby are now needing at this time. So some risk factors that we do know that could cause gestational diabetes is a family history of gestational diabetes or just regular diabetes, um, a previous pregnancy that you had gestational diabetes, a stillbirth or a macrosomic fetus, also obesity, hypertension, glycosuria, if you are pregnant and older than the age of 35. Um, but also just keep in mind that these risk factors don't necessarily mean that this is the end all be all, because more than half of people uh, who do get diagnosed with gestational diabetes actually don't have any of the listed risk factors that I just said either. So just something to keep in mind. So how is this diagnosed? So first, once a woman becomes pregnant, she has her first few visits or pregnancy visits, and they first test her hemoglobin A1C, and this depends on a person's glucose levels over time. So it's done initially just to test for pre-existing diabetes, or maybe if a woman is suspected to have it, and no fasting is needed, and normal results tend to be between 4 and 6%. Then, around 24 to 28 weeks, a woman is tested. It's a 1 hour 50 gram oral glucose screening. So, when this woman does this screening, if her results are less than 130, it's deemed normal and a good result. If the results are between 130 and 140 or higher, it's considered a positive screening, and they don't quite diagnose gestational diabetes quite yet, but it's just a positive screen, which then she has to go to another step, maybe a week or two later. Kind of just depends on scheduling purposes, but we still kind of want to fit within the 2 to 20 or 24 to 28 week margin. And then they do a 3 hour oral glucose screen, otherwise known as an OGTT test. And so this is where a woman comes in, and it's a lengthy test. So she comes in after fasting and they take her glucose level. Then they give her the 100 grams of oral glucose. And within an hour of that, they test it again. Within 2 hours of that, test again. 3 hours, test one more time. And if any of those two out of the four tested are met or exceeded, the patient does test positive for gestational diabetes. So it's just a further test to kind of, maybe the 1 hour was a fluke, or just that day she had a higher glucose screening due to things she maybe ate or drank or whatever it may be. So this 3 hour one is kind of like a safety net to make sure that we're not misdiagnosing either way. So why is gestational diabetes and preventing or knowing about it even important? So there's risks. So if for the mother, there's risks of preeclampsia, needing a C-section at birth, and postpartum, she may have increased risk of developing type 2 diabetes due to this diagnosis now while pregnant. As for the fetus, like I said earlier, they may be at increased risk of developing macrosomia, or also some risks for birth trauma due to being larger than normal. Also, they may develop some electrolyte imbalances, and most commonly like hypoglycemia and hyperinsulinemia. So once diagnosed, how can you manage it and make the most of the diagnosis? So first is strict blood glucose control, whether this is getting a monitor yourself or if you already had one, just to keep those levels pretty low. And we still want to keep them as normal as possible, which for a healthy human who's not pregnant, it's between 70 and 100. So kind of keeping it as close as we can to that. Exercise within reason while being pregnant, and what your provider is suggesting is a great level and not too excruciating. And then modifying your diet to make good, healthy choices and not having increased sugar if that's available. And then we want to regularly monitor that fetus just to make sure that everything's okay and no complications are developing. And then, if necessary, depending on the woman's state or stage of gestational diabetes, they may need insulin or oral medications such as metformin. During birth, we want to make sure that those insulin levels are monitored every hour, and we want to keep those levels at between 80 and 110. So a little different than just the 70 to 100, like a healthy human without this disease. And like I said, monitored every hour, and we will give IV medication during labor if those need to be adjusted. And then postpartum, the level should return to normal, but it is recommended to reassess patients with gestational diabetes about 6 to 12 weeks postpartum with a fasting test. And if the levels are where they should be at, no further interventions need to be done. Otherwise, we may, like I said earlier, need to discuss about type 2 diabetes and do further testing for that if levels have not returned to baseline. And then also, once diagnosed with gestational diabetes, it is recommended for lifelong screening, at least every 3 years is most likely recommended. So just keep all these things in mind when working with patients, and it's a learning process. It's a newer finding, so just if you have any questions, always ask your peers, but make sure you let your clients know that this is okay. It's a very controllable diagnosis, and that still really great outcomes can come from this, and just give them confidence in that. Thanks for listening.